welcome. You're watching the India Development Debate. I'm Tamanna Inamdar. Can your sugar-free soda or ice cream cause cancer? A news report that claims the World Health Organization is going to declare aspartame as a possible carcinogenic has soured the taste of those with a sweet tooth who want to watch their waistlines. The report claims that this artificial sweetener may be declared as an ingredient that has a possibility of causing cancer by one particular body of the World Health Organization on the 14th of July. A closer look at that report, though, shows that aspartame falls into the second least dangerous category as far as cancer is concerned, as per this body, and using your mobile phone is possibly as dangerous. In fact, eating red meat, consuming alcohol, and working on a night shift are probably more carcinogenic than your artificially sweetened beverage. The story, though, does highlight another bigger looming threat of whether such artificial sweeteners are enough to reduce the impact of actual sugar. And the big concern there is diabetes. As the number of diabetics in India shoot up, causing a threat to the population and the economy, the question really is aspartame or artificial sweeteners of other kinds of any use at all? And of course, to boot, should they be avoided if there is even the slightest possibility that they can cause cancer? To speak more on this, I'm joined now by Vikas, Dandekar, Editor, Pharma and Healthcare, ET Prime, Dr. Salil, Parkar, Medical Oncologist, Fortis, Hiranandani Hospital, Shubhda, Bhanot, Chief Diabetes Educator at Max Healthcare, and Dr. V. Mohan, who's Chairman of Dr. Mohan's Diabetes Specialities Center. Welcome to all of you, and thank you so much for joining us today on the show while we break this down. Vikas, I'm going to come to you because, you've done an excellent piece recently on the diabetes pandemic. And I know this aspartame story is just about broken less than 24 hours ago. Everyone's trying to figure out what's happening and wait for the WHO report. But don't you agree that the real story here is, do these artificial sweeteners even help with the key cause why they became popular in the first place? That is to avoid your chances of diabetes and lose weight.
Yes, absolutely right, Tamanna. Basically, the report which has come out earlier in June is an absolute red flag so far as diabetes control is concerned for India at 101 million, which is actually contributed a lot by Dr. Mohan's 12-year study, shows that this is a situation which really requires emergency measures. And in my report, I have actually quoted Dr. Anup Mishra also, who's strongly advocated for upstream actions like taxes on sugary products and parallel education and awareness system, which needs to be boosted right from the school grades of 8th standard and so on and so forth. So basically, I was reading a report a couple of years ago. It was $31 billion, which was the diabetes-related spends in India. It's already something that has already grown so much more from there, from 2017 to now. And some of the other countries which are actually grappling with diabetes. So, for example, I would like to take the example of US, which shows $379 billion spent on diabetes-related health expenditure, followed by China and Brazil. So China has 165 billion and Brazil 42.9 billion. So we, at that time, was $31 billion for us. I think it probably must have gone up exponentially. And that shows that going forward, it will be very difficult to handle mostly the demographic dividends that we speak of very fondly about young Indian population. If that gets impacted by diabetes, as I have actually spoken about in my report of a case study of a person with at 26 years having to take insulin because he was detected diabetes at a very young age by a random screening in his organization, shows that this probably is happening a lot more. And as the report which was published in Lancet shows, there may be 136 million pre-diabetics. So that adds up to quite a startling figure.
Report that 11% of the population could be either diabetic or pre-diabetic, and scary figures there. You talked about America. In the recently concluded Biden-Modi meet, there was so many stories that came out and, so many points that they talked about. But there is also a collaboration between the two nations on a diabetes research center, and that's an important point. But let me get to the gist of what we're talking about today. And Dr. Salil Parkar is joining us today. He's a medical oncologist with Fortis, Hiranandani. Dr. Parkar, I want to understand about the aspartame part of it, because there are many, many studies that have been conducted in various nations over time on the link between aspartame and cancer. And now we hear that this particular body of the WHO will declare it in the possibly carcinogenic category. What are the implications of that?
Right. So, as you have rightly said that, yes, they are about to declare it. I probably think that's somewhere in July. But you need to understand this in its totality. So, there is a part of the WHO which deals with this, which is known as the IARC. And that's basically designed to tell what is and what is not carcinogenic. Carcinogenic is any substance that can cause cancer. Now, the problem here is that it's not so easy to do this, right? So what they do is they classify these substances as some which are absolutely known to cause cancer, like say cigarette smoking, for example. And then there are others where the evidence is not so strong. Now, where they have put aspartame is something which is said that is possibly carcinogenic, which means that there is not enough data to say that it is carcinogenic in humans, but there is some evidence to suggest that it is carcinogenic in animal models, in mice in which these studies have primarily been conducted. Now, having said that, the IRC does not talk also about the dosage of aspartame, which is responsible for these kind of carcinogenic possibilities. Older studies seem to have suggested that you need to, and aspartame is everywhere, all right? It's in all your diet sodas, it's in your chewing gums, it's in everything where you want to substitute sugar. And the problem that arises is we don't really know yet what is the actual quantity that might be responsible for that kind of cancers in human beings. So this makes it tricky because we have now set in a panic regarding aspartame, which is fair if it is backed by very strong evidence. But as you rightly so suggested, even lack of sleep, even overnight work, even the radio frequency associated with the use of cell phones have been classified as possibly carcinogenic by the IRC. So that leaves us confused a bit. Let's see what they actually say about the dosage, number one. Secondly, we need to understand the implications of not using a sugar substitute and its link with obesity and diabetes for that matter. I am not going to say that aspartame is the solution for obesity or diabetes. In fact, there are studies which have suggested that diet sodas and all have not helped at all with dealing with obesity. In fact, quite the opposite, if you go by certain studies from France and otherwise. But we need to be sure before we classify something which is as a substitute for sugar and then immediately putting it on the carcinogenic table when we have put things like lack of sleep and even using cell phones in the same category. So I would wait on the data. I would not panic. But can you do without doing diet soda, and can you do without diet cokes, and can you do without diet chewing gums? Absolutely. So if you feel that there is a need to avoid it,
Dr. Parkar, what do you advise?
Because
you're an oncologist, when you speak to your patients, and I know that people who are suffering from cancer are first told to cut their sugar. Yeah. So do you tell them go diet?
So I absolutely do not tell any of my patients to substitute their sugar intake with dietary intake, to substitute it with aspartame or any of those sugar-frees or any of that. Look, it's easy to quit sugar. You can quit sugar. Sugar basically is not one of the most essential nutrients. It's not a protein. It's not an amino acid. It's not vitamins. It's not something that you really need. It's an addiction. And I'm not kidding when I say this. Okay, there is actual evidence to suggest that sugar causes a dopamine surge in the nucleus accumbens, an area of the brain, similar to what nicotine does as far as tobacco consumption is concerned. So it's easy to get rid of sugar if you make an attempt. I do not ask my patients to substitute the sugar with anything else. If at all, if a patient says that, I need to have a morning tea with sugar, I said, fine, go ahead. That's one bit of sugar in your entire day. Let's cut down on all the chocolates. Let's cut down on the meetha ho jaye and, all those. Let's cut down on those things. Let's cut down on telling kids that you need to have Complans. And I don't mean to name anyone, but on all sugary kinds of drinks which are being marketed as healthy options to just a good old fruit juice,
I don't want to spoil anyone's weekend fun. We're putting this show out on a Friday evening when all your consumption of sugar generally goes up. Dr. V. Mohan, great to have you on the show. As we're trying to break down all of these health-related headlines that come in and what their impact is. And this, of course, is the big one. So your view on the two things that we flagged off today. One is this report that says aspartame will be declared or could be declared as a possible carcinogenic, and whether overall these artificial sweeteners, is it a better bet to wean off sugar?
First of all, today's the report which has come yesterday and today is specifically about aspartame.
Yeah.
But just a couple of weeks ago, or 2 or 3 weeks ago, WHO had issued a more general one on all artificial sweeteners in general, which is very difficult actually. You cannot classify 8 different types of artificial sweeteners under one because they're all different chemicals. So what WHO said in that report, which has already been published, so we can discuss that, was that artificial sweeteners, first of all, in that report, the WHO report, the first statement they said was, this does not apply to people with diabetes. So that's the first thing. I deal only with people with diabetes. So that report does not apply to my population at all. So that's the first thing that I want to say. Second thing, what they talked about, they were not talking about people with diabetes replacing sugar with artificial sweetener. What they were talking about is non-diabetic people who take a lot of these diet sodas and things saying, oh, this is sugar-free, therefore I can take any amount of that. Now, that particular habit is very much rampant in the US, for example, where they drink tons of these sodas. All the time they're drinking this. I even heard true stories, this is not made up, that in the morning to brush their teeth, they use some of these sodas. And then throughout, when they wake up, the first thing they drink is not water, but this. And then they're drinking that throughout the day, which leads to huge rates of obesity in the Middle East and in the US and so on. I'm not sure that in the field that I see, people drinking so much of it. Maybe in an evening when if they don't drink alcohol and somebody says, they may say, okay, let me have the one without sugar. So I've seen them and they just drink one. I've not seen them drink 8, 10, 15 during the, and the highest consumption of artificial sweeteners, at least in my experience, is for coffee or tea. And how many coffee or tea do we have in a day? 2, 3, 4. We cannot take 25 cups of coffee or tea, isn't it? And what we do is we put half a sachet or 1 tablet or 1 drop. If you calculate the total amount that the average person takes, and say in my practice, it's a very small percentage. And at that percentage to produce carcinoma, I think is a bit far-fetched because everything is dose related. See, if sun is carcinogenic, okay, so can we ban the sun? So if you go and lie in the sun for hours together, you'll get skin cancer. So can we ban the sun? Okay, protect yourself, wear sun block or something, and then that's a way to look after it. Now, having said that, there is no smoke without fire. So when repeatedly something is coming up, if we can avoid these sweeteners, good, so be it. But for people in my field, when people whom I deal with, we already told them no sugar, okay? We told them cut down carbs. Now we are telling them no sweetener also, okay? So they say, but I have a little sweet tooth. And this is something I have to live with. So what do? Can I take, like the doctor said before, can I have 1 cup of coffee with this? No. It's carcinogenic. Don't take it. It's very difficult. As you just said, cell phones has already been for many years going on that this can produce cancer. Not really proven. They're saying brain tumors are due to this. We don't have the evidence. Now, in the WHO report is published 2-3 weeks ago, the randomized clinical trials, which were done on the sweeteners, actually showed benefit. And randomized clinical trials at the highest level of evidence. When the systematic reviews were done and meta-analysis were done, they actually showed benefit. But if you take isolated observational studies, there they showed, okay, your weight may go up. What they showed there was not cancer. What they showed there was your weight will go up, and therefore don't use it to lose weight. I'll also tell people, don't take these artificial sweeteners to lose weight.
No, so why am I taking it then? Then I want to understand what is the utility of artificial sweeteners? Because if anyway,
just for that little
it
sweet
is about
taste,
portion.
they take their tea or coffee without any sweetness, they don't feel like taking it. If they have some sweetness in it, and you remember that these artificial sweeteners are 200 times sweeter than sugar itself. So even a small quantity gives them that sweet taste and they say, I feel that I'm having. So it's for them. If they can take it without that, that's the best thing. But if they really want that, are we going to tell them that if
so
you take this,
so if I understand it correctly, between the two, the two, it's preferable to still have an artificial sweetener than actual sugar?
So So we just presented 3 studies at the American Diabetic Association meeting about 5 days ago, where we had 3 separate studies, but they were not on aspartame. Okay, they were on sucralose, and sucralose is a derivative of sugar itself. Sucrose, sucralose, it's a derivative. So we did all the 3 studies on sucralose. First one was in people with without diabetes. So we substituted sugar with sucralose in a 3 to 6 month study to see whether the weight actually goes up. Actually didn't go up. The waist came down, the weight came down, the sugar levels came down, triglyceride came down. So we were able to find benefit from 3 to 6 months. The next study was in people with diabetes. So we told people who develop diabetes, you stop sugar and then you substitute with this. And we found again improvement in the HbA1c, weight, and so on. The third one, which has been shown in animals, is that when you use these sugar substitutes, it kind of changes your gut microbiota. That's been shown in mice. So we did that. We gave them the sweetener, took the gut microbiota before and after, and we saw, did it make any changes? There were no significant changes in the gut microbiota. So as far as we are concerned, in the small doses that we take, of course, we didn't give them tons of it. We just said, replace your coffee, tea, instead of the sugar, replace it with this. So replacing sugar with this has some benefits in the small quantities. Now, whether, if it has really been declared to be a carcinogen, whether we should promote it, certainly not. We should stop that. But just before this meeting, to see whether there's any latest studies which have come, I just scanned the entire published literature on PubMed and so on, went through the entire literature. I'm not finding that strong evidence saying that, except in some mice, and men are not mice, that we know for a long time. Now, to see that, here is a study which has actually proven that it produces cancer. I'll be the first one to stop using it completely. I don't think we have that evidence. So I'm waiting for that July 14th report from WHO to see what prompted them to do this and to declare it as a carcinogen. And if so, are they laying down some dose and saying, don't take more than this? Okay, if you're taking 1 can, it's fine. Don't take, I believe, from what I've read this morning and so on from reports, from 12 to 36 cans of this diet soft drinks that you take in a day, 12 to 36.
No, then you're asking for a lot of trouble. You're asking for a lot of trouble in any case.
Whatever you take in that sense, you will get it. You take too much of tomato ketchup also probably will do you bad.
Okay.
If you keep on taking every hour.
I want to just get some perspective that, there is so much health awareness right now, more than ever before. More than ever before, such kind of medical literature has become mainstream. But the fact is, on the other hand, diseases like diabetes are marching on. Shubhda, Bhanot, what are the concerns there? Because there seems to be a lack of clarity. The more information we get, the more unclear we are on how to really stop this epidemic.
Thank you for the question. So for stopping the epidemic, the main thing is lifestyle change. We see these days in our clinics, younger and younger children are getting type 2 diabetes. In the COVID era, we saw that children became more physically inactive. The screen time increased, and we saw a rush of these children with obesity and having type 2 diabetes. So by increasing physical activity, by reducing weight, by changing the way we are eating, less of processed food, we will be able to stop this pandemic. We will be able to reduce the number of cases that we are seeing. And I'm really worried about the pre-diabetes. Yes, we have more than 100 million people now in India with diabetes, but we have nearly 136 million people with pre-diabetes who are just waiting to become diabetic. So we have to work there. We are talking about reversal these days, but where are we talking about prevention? We have to really work on prevention. We have to really work on exercising every day, eating a balanced diet, reducing weight, sleeping well. Sleep hygiene is so important. We're already talking about carcinogens, and we just talk about, not having a good sleep cycle can lead to cancer. So, we have to really work on these things, reducing stress levels in our life. So these are the things which we have to work on. PCOS in women, in adolescent girls is also a major risk factor for developing type 2 diabetes. So it's a whole these risk factors that we have to work on. And as far as these artificial sweeteners are concerned, Dr. Mohan has actually really briefed it so well that we can eat it in small amounts. We are not eating it in huge amounts. Most important is how much we eat it and for how long we are taking it. For example, in aspartame only, the acceptable daily intake is 40 milligrams per kg body weight, which actually takes us to nearly 60, 70 packets in a day. We don't consume that amount. We consume it in very minimal doses, right? So if we are taking anything in restricted quantities, in moderation, we are okay. Anything in excess is bad. Even if we eat our simple rotis and rice in excess, that is also bad. We will end up gaining weight. So till the time we are taking the path of moderation and we are maintaining our weights, we are exercising daily, I think we'll be doing good.
The thing is that all of these pieces of advice and the lovely things that Ms. Shubhda, Bhanot have said have been known for years. This advice has been going on for years, yet the numbers are consistently increasing. There is where the concern begins. Vikas, this is some of the things you highlight also in your report. Were you able to find any real causes why India is seeing this huge surge of diabetes and pre-diabetes?
So I think all the doctors in the panel are very well aware of all the situations here, but there is a sudden economic prosperity which is seen. A lot of IT jobs have come in, and that has led to a lot of sedentary kind of lifestyle changes. People at very early ages have started making a lot of more money. That was not the case. In fact, even more disturbing is the prevalence of diabetes that is being seen in the rural areas. That was something that was not actually seen before. And in my report also, I have actually mentioned about the increase in the diabetes-related expenses. Just the market in the last 20 years, up to 2020, went up by 6 times. So only anti-diabetes oral drugs are actually selling at around 17,000 crore rupees. That's massive. That actually shows where we are heading. And that probably is the reason. And as Dr. Bhanot also mentioned, the entire drive has been towards treating patients. There isn't much effort being put on prevention. I mean, and also one of the reasons of patients not getting detected is that, many of the patients actually feel at the marginal side of the society that if we get detected, then there will be an additional cost. The incomes will get impacted. So those are the things that need to be seen very closely. I spoke to a few other government officials also. They also admit, so from 2010, there has been a detection program for stroke, hypertension, cancer, diabetes. That needs to be probably ramped up. And, this education at a very primary level is something that will be extremely important, because this is exactly where the US is was heading. And we are also moving in that same direction. So I think that's probably the reason.
Very, very serious issues, and obviously goes beyond that catchy headline that aspartame can give you cancer. Perhaps we'll wait for the actual report to come, but there are many more reasons to think about what you're putting in your mouth and in your stomach in a variety of ways, and aspartame alone may not be the big villain of the piece. Thank you so much to all of you for joining us on the show today. And don't feel bad if you're going to think twice about what you're having this Friday. Moderation is key, as the message that came out from our panel.